Here in the UK, our government has announced schools are going to reopen on March the 8th. In the US and many other countries worldwide, schools are remaining closed. On social media, I see increasingly extreme polarization of opinions on this, from people saying that it's either a terrible idea or others saying it should never have been done. And worse, each side accusing the other of holding their position for ulterior motives instead of genuine concern. But what actual evidence do we have to go on? It's entirely normal to feel strongly about this, but there are a lot of assumptions being spread around as facts, and I'm not for a second criticizing anybody's passion for their stance, but this is an attempt to look at the best possible evidence. One of the themes in my videos through the pandemic has been that there's so much bad science out there, you can find some lousy study to support whatever position you want. So I'm paying particular attention to the quality of the evidence. My name is Rohin, I'm a doctor in the UK, and I'm writing and recording this on the 25th of February. This video cannot be a detailed attempt of everything, it would be way too long, but I did want to tackle this topic. It's just dominated tonight's evening news, and so I want the video to instead serve as a kind of launching point for those who are looking to learn more about it, because I'm going to put a lot of further reading in the description box below, and I'm going to only try to say things that have got references. I'll start by laying my cards on the table. I'm not a public health doctor, I'm not an epidemiologist, I'm a hospital doctor. However, I'm not planning on presenting any of my own opinions here anyway. I'm just here to act as someone who's literate in medical evidence, relaying it to you. I'm also a parent of 2 children, although due to where I live and my status as a key worker, my school-age child is currently attending school. So I hope you don't think I'm saying this out of any selfish motive, because my kids nor me will be personally affected whether schools are open or closed. And I've also got friends who are teachers, I've got vulnerable family members, and I've seen the pandemic at its very worst inside the hospital. So I would like to think that I am neutral, but of course we all have our biases. And I'm only saying all this in the interest of transparency, because I know some of you are not going to agree with everything I say. So what are the issues that we're dealing with? Millions of children worldwide have not attended school for close to a year. Even in the most developed countries, access to the internet is not universal. And school acts as more than just a source of education for many. In my borough of Newham in London, there's a high rate of poverty, and schools provide safety, food, a place to work, exercise. You can develop lifelong social skills, and of course, support to vulnerable children. Education is the most important route out of poverty, and while teachers have been trying incredibly hard to maintain delivery of curricula during the pandemic, I don't think anyone would argue that it is impossible to replicate school at home, and there was ample evidence for this even pre-pandemic. So closing schools widens pre-existing gaps in social deprivation between rich and poor families. It sometimes gets forgotten as well that it exacerbates gender divides, with women disproportionately responsible for childcare and being forced to take more unpaid leave than men, or to stop working entirely. Domestic violence and deteriorating adult mental health during the pandemic has also contributed to increased risk to children. In Japan, a country without a lot of the other lockdown measures that we've had here, but where schools did close, childhood obesity has risen as children stayed at home, and so has maternal anxiety. Disabled children, those with special educational needs, those from poorer households, are disproportionately adversely affected by school closures. Last year, GCSEs and A-levels, the main exams at about 16 and 18 years old in the UK, were cancelled. They're going to be cancelled again this year. There was a complete fiasco for those who were hoping to enter university last year. And that's just one example of the long-term effects on children and future adults that can perhaps never be truly measured. When people say lives are at stake when talking about COVID, it's not simply about numbers of deaths, it's also about entire unlived lives. However, on the other hand, opening schools could potentially increase the spread of the virus, prolong lockdown, and cause more deaths. People who are opposed to schools reopening are not saying this because they want to ruin children's futures or anything awful like that, as they're often accused of, but because they are understandably worried that a large mixing of children might exacerbate things. So let's start with some common ground, and I hope something positive, something we can all agree on, that children themselves are exceedingly low risk from this virus. While there have been some high-profile stories about inflammatory conditions associated with the virus, these have been shown to be incredibly rare. They do not represent a significant increase in baseline risk facing children from other infectious diseases that already exist. So So children are at low risk. That's the first good news. They're also less commonly infected. The European Centre for Disease Prevention and Control say that less than 5% of cases in Europe are in under 18s. Now, yes, of course, some countries will be undercounting because, just like here in the UK, we've not been testing kids very much. And about 50% of childhood cases seem to be asymptomatic anyway. But studies from countries that had mandatory testing in schools, irrespective of symptoms, showed transmission was low, especially with under 11s. And I know it's a sort of old joke that kids are these germ-spreading vectors and schools are petri dishes and kids bring all kinds of germs home, but this doesn't seem to be the case for SARS-CoV-2. Children seem to be about half as likely to contract the virus with a similar exposure in comparison to adults, and much more likely to have a mild or asymptomatic infection. We're no longer in the early stages of the pandemic when defaulting to closure was maybe understandable in the face of something new. We're a year on and we've got data. And so for the sake of child education and welfare, the default should now be to keep schools open unless there is strong evidence to keep them closed. So, do we have that? Reopening schools is likely to increase transmission as children will have more contacts than they do at home, and there's concern that children can bring the virus back to older family members. However, only 3% of over 65s in the UK live with children, and one of the analyses from Ben Goldacre and Laurie Tomlinson's team of 12 million people in the UK showed that there was no increase in risk of adult death in households with or without children. So that's an important point. It's almost impossible to tease out the specific contribution of school closures on community transmission. But in observational studies with enough information to attempt this, school closures did not appear to have had a significant impact on reducing transmission. In Germany, there was a clever study which used a staggered opening of schools and found that there was absolutely no effect on spread amongst kids, amongst teachers, or the community at large related to school opening. So much has been made in Europe of a second surge last year in European countries coinciding with schools opening, but correlation is not causation. The European Centre for Disease Prevention and Control's recent review disagrees that it was the cause. So now there is a large body of evidence saying, 1, closing schools was not particularly effective, and 2, reopening schools is not associated with a significant increase in spread. From the European Centre for Disease Prevention and Control again, if physical distancing and hygiene measures are applied, schools are unlikely to be more effective propagating environments than other occupational or leisure settings with similar densities of people. But opening schools does not mean opening everything. Other measures should still stay in place, like the majority of people continuing to work from home. We know from countries like Sweden that schools can reopen safely while continuing to reduce transmission if other precautions are rigorously enforced. Scotland controlled the virus in summer last year, and schools opened in the autumn term with very low rates of positive results for the first half of term. When national cases started rising, school cases followed this. They didn't precede it. Schools should be the last things to close and the first things to open. Okay, so what about the entirely understandable fear of increasing risk to teachers and other in-person staff in the schools? I'll quote from a recent summary in the British Medical Journal. In-person learning increases teachers' exposure and might be expected to increase their risk of becoming infected, but accumulating evidence shows that teachers and school staff are not at higher risk of hospital admission or death from COVID-19 compared with other workers. These are data from the US, from North Carolina, and from Sweden. Teacher absence because of confirmed COVID-19 in England was similar in primary and secondary schools in the autumn term, despite secondary school children having much higher rates of SARS-CoV-2 infection. Moreover, teacher absence decreased in Tier 3 regions during the November lockdown, despite schools remaining open. The World Health Organization said transmission between staff is the main route of spread, not between staff and pupils. Again, another important point to emphasize. I wanted to give a good answer to teachers' safety as a question, so I really dug into this, and I think it could be summarized in the following way. Staying at home would obviously constitute less risk, but the risk accumulated by teachers does not appear to be higher than parents of children going to school, and it's markedly lower than other workers classed as essential who are public-facing, people like taxi drivers, bus drivers, things like that. The role for vaccination in children at present remains unclear as well. There are trials ongoing of efficacy in children, with the weather improving in the Northern Hemisphere and as lockdown starts easing over the next few weeks and months. We'll still have a large unvaccinated part of the population, including young adults and teens. And what we absolutely need to avoid is those people feeling, well, lockdown's ended, I feel fine, so I'm not going to bother getting vaccinated. And that would be a real disaster, because we need the majority of people vaccinated to ensure that we do not need to have any lockdown again, at least not for this pandemic. Remember, the vaccine is all of our way out of this, and if it will assist schools reopening safely, then teachers should be prioritized for vaccination. We don't have the evidence at present to say what the effect of vaccinating teachers would be, but I think it is reasonable to say that if I, as a healthcare worker, have benefited from the vaccine, why shouldn't they? Now, I said I wouldn't include any opinion in this video, and I've tried to avoid doing that, so this is my signpost to you that I'm going to close with an opinion. There are a few categoric right or wrong answers in this pandemic. As I've hinted in previous videos, reducing science to black and white is not only simplistic, it's dangerous, and it's not scientific. There have been debates about the merits of lockdowns and masks and so forth, but I can't think of a more important group who are more disenfranchised, with more years ahead of them to be affected by what's happening, than an entire generation of children. A year without face-to-face teaching, which has been the case in many countries, including the developing world, where resources are far poorer for home learning, may have untold repercussions that won't fully emerge for many, many years. Now, I don't say this to tug at any heartstrings, but to explain what is being discussed here. If you're a teacher or a school nurse or any other staff working in a school, thank you for watching this far. And let me end by saying thank you as well for the Herculean efforts you've been making throughout this pandemic to help educate our children during this appalling time. We all appreciate the immense positive impact that you have on your students, and this is most pronounced when you can do your jobs the way you always have in person. I would never seek to downplay your concerns, and I know firsthand just how hard you've been working. To suggest teachers' uncertainty about reopening is driven by anything other than concern for everybody's safety is unkind, and it does nothing to move us forward. It's clear that this pandemic has exposed horrendous chronic underfunding of public state schools in many countries, and teachers have been left to pick up the pieces. What has been really criminal has been the lack of support for teachers and schools, with many being forced to devise safety plans, contact trace, buy additional equipment, including their own PPE, change schedules, adapt to 2 years of cancelled exams, changing teaching programs, predict grades in a way they've never done before, all without the help that they need from the government. In the UK at the moment, we've got a particularly incompetent government, I think the worst in living memory, and the health secretary and the education secretaries are probably the worst of the bunch. Opening schools may not come without risk, but we can never aim for zero risk. We can only use not only science, but social science, history, talking to people, and of course, our values as human beings to make the choice with the lowest net additional risk to different groups within society. Children, after all, are all of our futures.